Spring into summer by looking younger. Call Vein Clinics of Hawaii to schedule your free consultation today. Facial and body rejuvenation procedures are designed to help you look and feel your best without breaking your budget. Reduce pigmentation, fine lines, wrinkles, scarring, and stretch marks with minimal invasiveness or side effects. Confused about which procedure is right for you? Call 427-5565 to schedule an appointment or visit veinclinicsofhawaii.com.
Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juleff of the Vein Clinics of Hawaii.
Well, isn't that nice of you to drop in? And I can see you. I can see you out there. Some of you have become regulars, and we like that. Some of you are first-timers. It doesn't really matter because our shows are timeless and ageless, and we do circle the wagons every now and again so that we don't think that you've been with us for all 40 shows or 44 shows or whatever it is. But I can tell you that some shows have consequences at the end of them, and a lot of questions come up. So what Doc has done here is encapsulated a whole gotten a whole bunch of these questions together. So that it's like you're going to be listening to 20 shows at one time. So consider yourself, it's a little bonus gift we try to give everybody, isn't it?
Yeah.
But it is amazing how many people will ask us questions after the fact. And, you can always go to veinclinicsofhawaii.com and contact us that way, and also by listening to the show. And if you come up with something that you want to know about, we'll be happy to incorporate it into a show. And so these shows, this particular show like this, we're going to jump around a little bit, but we sort of promise that everything's going to make sense. If you spend the whole hour with us, at the end you're going to say, boy, I'm glad I did that. So obviously, if we're talking Vein Clinics of Hawaii, Doc, the most frequently asked questions, the number one question would be, what are varicose veins anyway?
That is probably the number one question. But by the way, with respect to the website, we have a spot on our website where people can actually go, click on a link, and ask questions. I've thought that this show would be a good place to answer questions. So as they come in, we'll be happy to answer questions on the air.
In other words, you're going to be feeding us hints on what you want to hear next.
Right.
Yeah, that's good. That's what we want.
Definitely. Sure. We want that. So varicose veins, I think that most people recognize exactly what they are. They're dilated, ropey, elevated kind of veins that typically people see on their legs. But the crux of the answer to this question is that varicose veins are not the problem. Mm-hmm. When somebody has varicose veins, typically that's not the only thing that's going on. Usually a varicose vein arises from something that we call venous insufficiency.
Okay.
And venous insufficiency basically just means that the function of the deeper veins in the legs, not necessarily the ones that you see superficially, but the veins that are deeper in the legs, they are starting to fail in their function, and then typically it results in symptoms that we'll talk about in a little while, but also it results in superficial varicose veins, spider veins, etc.
So in other words, that might just be a harbinger of, hey, I got these now, and it may be indicative of something else being where I can't see it.
Right, exactly.
Okay,
So, varicose veins, when we see them, basically they are just a symptom of something else going on, just like any other symptom might be.
Okay, one, and I know the number one question that I've heard was what causes it?
Right.
And you run the gamut. Is it diet? Is it exercise? Is it too much sun? Is it too much cold? What is it?
Right, yeah.
Besides mom giving it to you as a hereditary deal.
Yeah, right? Usually genetics are involved. But, what's happening there with respect to the loss of function is that the veins, particularly in our legs, depend on one-way valves. Veins are the blood vessels that carry blood back to the heart. So veins in our legs should be consistently moving blood upwards on its way back to the heart. And since we don't have a lot of little hearts all over the periphery of our body pumping that blood up, it has to move in a more mechanical fashion. And the way that happens is that there's many little one-way valves that keep the blood moving upward. And unfortunately, those valves, they're just tiny little flimsy pieces of tissue. Really, it's not a complicated kind of valve, but those valves can fail. And when the valves fail, then the blood starts to, rather than continually moving
it's
upward,
trying to go uphill.
Yeah,
and it's not.
But but gravity starts to pull it down. That's why we need those valves, because gravity is trying to pull the blood down. So, the valves fail. Blood starts to move downward into the leg and create something that we call pooling. That just means there's too much blood kind of hanging out in the leg. And that's what then creates the symptoms that we have. And then also it, that increased flow downward, which creates pressure within the vein system, then gets transmitted out superficially. And that's what leads to varicose veins.
Yeah, and that's in a nutshell, that's kind of the crux of it. But there's a lot of other things, and we for instance, we know that it is not an equal opportunity employer 100%, but it's common in men and women.
It is,
and I know because I'm a patient. But actually, there must be, even within the sexes, certain risk factors.
There are, there's several risk factors, and probably the strongest one is genetics. Like you alluded to before. If your mother had it, you are very likely going to have it. If your mother and your father had venous insufficiency, then it's almost a foregone conclusion you will probably have some form or some amount of venous insufficiency. So, genetics is probably the number one risk factor. The
good news is, gang, you don't just throw in the towel once you find out, well, it's genetics, I can't do anything about it. Not true.
No.
There's certainly management. Well, that's what we're going to talk about here.
Yeah, sure. And it's, unfortunately, the treatment of this stuff is getting easier and easier all the time. It's not, the treatment nowadays is not like what your grandmother got, which is a very good thing. But the next risk factor is age. And, as we age, the likelihood goes up. But that's more of a reflection of just time passing. I mean, obviously, we age as time passes. But, as time passes, then, those valves have more time to fail if they're going to. The process has more time to get worse if it's going to, which it often does. So typically we see age as a risk factor, and the likelihood of you having some amount of venous insufficiency is going to be greater when you're 60 as opposed to when you're 30.
Okay, but we, like Doc said a minute ago, that doesn't mean that you should start pulling out your hair and say, woe is me, because even though you may have remembered grandma or mom, the treatment certainly is way different than it used to be. So that's one of the first things that goes out the window when you go to a modern vein clinic.
Yeah, in the past it was almost, depending on how many problems the patient was having, the treatment was the cure was almost worse than the disease.
Certainly invasive.
Right? And not so now. We can take care of things pretty easily, which has made it fun. You know. So the next risk factor is female gender. And although, like you said before, we see it in men and women, but it's a little more frequent in women, and that's due to probably several different things, not only genetics, but also pregnancy. Because especially women who have had multiple pregnancies, that puts them into a little higher risk level. And pregnancy, there a couple different issues there, because pregnancy creates a mechanical problem. As the baby is growing and the uterus is getting larger and larger, that is impinging or resting upon the larger pelvic veins, which can then subsequently create functional problems in our legs. But there's also a hormonal aspect of pregnancy. that kind of adds to the likelihood of a woman developing venous insufficiency, particularly during a pregnancy, and again when it's repeated. So many women may develop symptoms and even varicose veins over the course of a pregnancy. After they deliver, often those varicose veins recede, their symptoms get better, and it's not a problem. However, after 2 or 3 pregnancies, then the symptoms start to not go away, varicose veins start to not go away, and then we address it at that time.
Yeah, and interestingly enough, gang, in other shows I've learned in different parts of the world, this is even different. And I mean, here in our country, you would think we'd have way less of it because, generally speaking, in America, per capita, we're having less babies. Mm-hmm. I mean, some of the underdeveloped countries, 5 or 6 or 8 kids is normal.
Right.
And here it's 1.5 or whatever the number is.
Sure.
However, we talked about this in other shows, and just a quick thought about this one is that in many respects, women that are career-oriented nowadays are typically having their babies a little bit later than they used to.
Right.
Does that factor?
Very possibly,
Mm-hmm.
yeah, because their bodies don't bounce back the way they do. A woman at the age of 40, let's say, and women are having more babies at that age. Just the aging process is not going to allow their body to anatomically and structurally. Get back to a baseline the way it does when you're 20. So might that even put them into a little higher risk bracket for developing venous insufficiency? Sure, yeah.
What about some of the other things? And we are going to do a whole program down the road, and we've already done some on just pregnancy, period. But the other thing is that what if you're pregnant and what if you're obese?
Right.
We talk about obesity, men and women. Mm-hmm. Are you at a greater risk because you're obese?
Mm-hmm. Yeah. Obesity is one of the risk factors of venous insufficiency, just in general. No question about that. And women who gain a lot of weight during pregnancy, they're at even a little greater risk of developing, vein problems. But just in general population, people that are obese or overweight, they are at a little higher risk, a little higher likelihood that at some point in their life they're going to develop venous insufficiency. And then in addition to that, in the obese population, there's something called lymphedema, and we've spoken about that before. But lymphedema is swelling that occurs in the legs from a little different reason, not specifically venous, although they go hand in hand. They very much go hand in hand, and so that's another complicating feature that we see in the obese. And then the fourth main risk factor are those people who spend a lot of time on their feet. Especially at work, or if they have hobbies, that keeps them on their feet throughout most every day, they're at a greater likelihood of having.
It's really interesting you say that, because as you know now, they're developing workstations,
right? So
you don't have to sit. And now I know a guy that does not sit anymore, and I'm thinking, okay, you have to work out a medium here. The reasons why it's adjustable is sometimes you're down here, sometimes you're up there. But you're right, and there's more and more professionals. A good friend of mine who recently retired, an orthodontist, on his feet for 40 years.
Sure.
Every day, 6 days a week.
Right.
And so obviously, if you are prone to, varicose veins, it's going to be extra special.
They're going to progress quicker.
Yeah, that's what I meant.
Those professionals like nurses, hairdressers, we see a lot of teachers.
Oh, of course.
And because, again, they're also on their feet for many years.
How about a PE teacher? Not only are they on their feet, but they're running around all the time.
Yeah. So professional. There's professional risk factors associated with that too.
It is a decision that people are obviously making, though. I mean, everybody that, a friend of mine is the third generation hairstylist, barbershops.
Yeah.
Best haircut in town kind of guy, right?
Yeah.
He'll limp in there if he has to.
Hopefully he's wearing compression styles.
Yeah. Actually, that's another thing. We could do a whole program on that. But But in other words, if you are in the workforce on your feet as a rule and you have varicose veins, there's a bunch of stuff that can be done.
Oh, yeah. Sure. In reference to the adjustable desk, which is the thing to do these days, like you mentioned. And I can remember a few years ago, there was a journal article that came out and some guy was saying that you can decrease diabetes and high blood pressure, and all these things become either go away or become more easily treated in people who have gone to this elevated desk in a standing position. And I thought, they were not thinking about vein disease.
I was going to say, they skipped out.
Yeah.
I remember when they first came out with those ergonomic chairs.
Yeah.
And it turned out that they were wonderful. But then if you were prone to have back issues, they were magnified. But, I guess I'm really good, but I hurt.
Yeah.
But that is, it's worth noting, right? Mm-hmm. In other words, moderation and everything. Stand a little bit, sit a little bit.
Right. Exactly.
Okay, so and you mentioned this earlier, and I know this is another question that comes up all the time. It's all about why the legs, and simply you say it's gravity. What else?
Gravity, and gravity has its greatest effect on our legs as we are standing again most of the day. Gravity is pulling that blood down, and there's also something called hydrostatic pressure, which is mainly just pressure on a column of fluid is what it is. But and our blood vessels can be thought of as a column of fluid. And as we stand up, the pressure within those blood vessels is much higher in our lower leg than it is in the upper part of our bodies. So that's why it happens in the legs in particular. Now, can it occur in other places? Yeah, it does occur in other places. But the question that we get all the time is, look at all these big veins in my arms and hands, because a lot of ladies come in, they don't like the look of that either.
Of course, a lot of bodybuilders come in and say, how can we make these bigger? These look great.
Right. Or I had one that, he had a huge amount of varicose veins, and he was kind of picking and choosing. He's like, get rid of this one. No, leave that one. So, but
geometric designed, veins. Yeah.
Yeah. So, but the answer to that is yes. But in the arms, no. Typically, it's not thought of as being a pathologic kind of situation. It's not a loss of failure. I think some people just have large tortuous kind of veins in their hands and arms, and that's just the way it is. If you look up now, are they varicose veins? I guess you might call them varicose veins because the definition of varicose is enlarged and lengthened and tortuous and that kind of thing. But, and do they look like that on some people's arms and hands? Yeah, they do. But it's not considered pathologic, and basically what it boils down to is insurance doesn't pay for it.
I wonder how silly this one is. I get paid, by the way, gang, extra money for really asking dumb questions, because we want you to all realize that there are no such thing as a dumb question. Yeah. When somebody is doing a blood draw, are they taking the blood out of your vein or out of your artery?
Vein.
Yeah, see? So that's what I'm thinking. So some people are, I guess, wow, you have a lot of veins. You had no problem.
Yeah.
And I remember when I was really big, they called it a hard stick.
Yeah.
Because they just couldn't find veins.
Yeah, right. Some people are just the opposite. You can't see any of their veins. And it's difficult to start an IV, draw blood, et cetera. So it's interesting.
Okay, so anyway, the reason why they occur more in your legs is because it's a bunch of them there, and it's at the bottom of the pile.
Yeah. Bottom of the pile and highest pressure.
What about guys and gals at work standing up, but they also commute? And now, after work at 4 o'clock, they jump in their car for an hour, where they're sitting down for another hour,
right?
Which you can't get up. Or really, you can't really pump your feet too much because you don't want to hit the brake pedal or the gas pedal.
Yeah.
So that's another consideration, isn't it?
It is, and prolonged sitting is another thing that's going to make venous disease progress. It's prolonged sitting is not as bad as prolonged standing, but your legs are still down, in what we would call a dependent position, and especially if you're sitting in a car for a long time. It's not like your muscles are contracting; they're not, it's a setup for venous progression.
I have a friend whose family, they love to travel. They've been, I think, except to Alaska, all the states, and they love driving around. But they're just pragmatically religious about stopping at rest stops or a gas station or whatever, just walking around for 5 minminutes.
Yeah, well, not only is that good for your vein health, but it also may prevent DVT, deep vein thrombosis, blood clots. So it's a good thing to do.
Yeah, we talked about that on the airplanes. We'll talk about that for sure. But, I know there's another thing, and the reason why you're a specialist and there are specialists, there are a number of symptoms and things that can happen to your body that aren't caused by what you think they're caused, and vice versa. So, do most people get turned on to the fact that they might have a venous situation because of symptoms?
Yes and no. I think some symptoms of vein disease are easily connected with vein problems by lay people in general. Obviously varicose veins are one of those. Yeah. It's a pretty easy connection, but unfortunately, a lot of the symptoms that are a part of venous insufficiency, especially the more advanced stages of venous insufficiency, people don't recognize that as being a vein problem, like chronic swelling or skin problems or skin breakdown, discoloration, all those things. But the next question, and this is along the lines also of, are legs the only place that you might develop varicose veins? And like I mentioned before, the answer is no. But there's a condition called pelvic congestion syndrome, and we've spoken a little bit about this in the past. But basically, pelvic congestion syndrome is just the presence of varicose type veins, veins that are enlarged, dilated, tortuous, not functioning properly in the pelvis of women connected with the pelvic organs, the uterus and the fallopian tubes, etc. And when those veins become dilated, then they start to develop a set of symptoms, which typically is abdominal or pelvic pain, pelvic fullness, those types of symptoms that may come and go based on their menstrual cycle.
That seems to make it maybe a little more difficult because there are several other things that can cause those symptoms.
Sure.
So you really have to sort of get a grip of what you're doing and then have the patient realize that they have to sort of really explain their feelings, because doesn't that help you a lot?
Sure, yeah. And always when I am speaking with a lady that I think might have this thing called pelvic congestion syndrome, I often will ask them to just, go to the internet and do some Googling of that topic and see if, what is written and what is described is what you're, feeling day to day. It's not super. Often it's not superficially apparent. It's not like it's going to be apparent by just looking at the patient, examining the patient. However, I will say that many women with pelvic congestion syndrome, since it's sort of the same kind of process, will also have leg vein problems.
Sure.
So that's that's one good thing as far as the tip off of what those symptoms might be like. Pelvic congestion syndrome is one of those situations where, varicose veins are residing in our body somewhere other than our legs. Yeah,
and that's, however, the overwhelming number of cases are in the legs.
Oh, yeah, definitely. Yeah, the likelihood of venous insufficiency in a middle-aged woman is much, much, much higher than pelvic congestion syndrome. Yeah, definitely.
Okay, so ladies, thanks for what you do, because we know that a lot of what you do for us is what causes some of these conditions that we're talking about.
Yeah, pregnancy.
Okay. Listen, there's another thing, and that is knowing that you have varicose veins or venous insufficiency is one thing, but what about when it gets time to take a look at when should you see a professional, especially a specialist like yourself? And number two, when is that specialist likely to say, okay, the conditions that you have indicate we need some form of a treatment plan?
Yeah, and the first step there is recognizing the symptoms as being, due to vein function.
Sure.
And we kind of alluded to that before. Sometimes it's easy, sometimes it's not so easy. But some of the symptoms that we see that are pretty specifically related to venous insufficiency are achiness, heaviness, and fatigue. Those are very specific symptoms for this problem. And numbness and tingling, obviously varicose veins, spider veins we've talked about, muscle cramping, swelling we mentioned before. There's something called restless leg syndrome, that has to do with people kind of unconsciously moving their legs, not twitchy kind of things, but just kind of moving their legs because movement of their legs helps their symptoms. And then skin changes, but specifically, with respect to the question, when should I see a doctor if I have varicose veins or if I think that I have venous problems? And a lot of that has to do with the symptoms.
Sure.
Are you having those types of symptoms?
Who wants to have sore legs, for instance?
And especially if you feel like it's interfering with your daily activities.
Yeah, bingo. That's the number one, I would think.
Sometimes people come in and they say, gee, my legs are tired. I can barely stand at my job. It's hard to get around. The other thing that we hear all the time is, gosh, I used to be able to go to the gym and work out and stayed healthy, et cetera. And symptoms of venous insufficiency are actually keeping them out of their exercise program and interfering with their, general health. Not only the health of their legs.
Yeah, which, by the way, we all often categorize that, friends, as choices and not necessarily style of life, but quality of life. So if you have a symptom that makes you tired so that you can't go out after dinner and walk around the block with your significant lady or husband or dog, that may be something worth it alone to get treated because you're not able to do what you want to do.
Sure. Yeah. I mean, venous insufficiency can hugely impact quality of life. Yeah. So, there's symptoms like that, fatigue, heaviness, aching, restless leg, that are concerning and should be addressed if they're interfering with daily activities. But the higher level, we talk about the classes of venous insufficiency and those higher classes of the disease process that start to cause changes within the skin of the lower leg, discoloration, thickening of the skin, etc. Those are even a little more concerning. And with respect to the question, when do I see my doctor? You should definitely see them.
Yeah. And by the way, the light at the end of the tunnel is, like we were talking about before, where this might be standoffish for many that think of the past. Those days are way long over. I mean, it's just really so. When you, even the way you diagnose them now, I mean, we talked about the ultrasound, which I hope is going to come up here anytime, and that is, it's just an invaluable tool that saves probably countless other experimentations to find out what's wrong with someone.
Oh, yeah.
Because boom, here it is.
Sure, yeah. So, some of the specific events or occasions where you should definitely be thinking about going and getting evaluated are if you develop an episode of phlebitis. Now, phlebitis is something that we call superficial venous thrombosis. And basically what that is it's a small varicose vein or a small superficial type vein that for whatever reason clots off and creates inflammation and redness and tenderness. And that can be sort of a harbinger of, deeper problems and other venous type things that are going on. So if you have an episode of redness and tenderness, that goes away.
Yeah.
It's one of those things that's it's sort of a sign additional problems, but sometimes it goes away, and then people lose track of it and don't give it a second thought, and it doesn't get evaluated. But those are that's one of the situations where you definitely should have somebody take a look at it.
I have to react because I'm a patient. So when we're doing these shows, quite often something that Doc says reminds me of where I was prior to my treatment, my organized treatment. And that is, I would imagine that even as long as you've been in the business and a lot of your peers, some of you are just shocked at how long people will put up with a symptom before they come in and say, "Do I have a vein problem here?" When it's as big as a galvanized pipe sticking out of their leg. Gee,
right. Well, you're right. It's unfortunately people can ignore symptoms for quite a while, or they don't, or they're not directed in by advice from other people or other physicians, whatever. But couple of other absolute specific situations where you should go is if you have, chronic swelling, especially if there's discoloration of the skin, and you have developed a sore on the lower leg, something we call an ulcer, that is slow in healing, or maybe it doesn't even heal. That's a very, very strong sign that something bad's going on and it needs to be addressed. But I mentioned before the skin changes. The skin gets thickened.
Sure.
Even if you don't have a sore, if it's thickened and brownishly discolored, etc., those can be very strong signs of vein problems.
And would that be, Doc, also a sign or a strong sign that it's probably been there for a while?
Yes. Yeah, those are kind of...
These not really overnighters or anything.
No. Yes. When people start to have skin changes and chronic edema, it's sort of late in the disease.
Okay.
If you have bleeding from a vein, and we see this periodically, usually it's not a big varicose vein, but often it can be just a tiny dilated spider vein, and usually it happens to spider veins that are lower in the leg, more so on the ankle and foot. If you have spontaneous bleeding from something that you think looks like a vein, then that's another time to be looked at. There's no question about it.
And by the way, it's interesting to me is sometimes those veins are small. I mean, especially the lower down the leg, they are. They're not the big pipes.
No.
But if they start bleeding, they don't stop. You got to get them to stop.
They bleed a lot because they're under a fair amount of pressure, we said before. And although for 99.9% of the time, the bleeding can be controlled easily. We tell everybody, hey, if it happens again, put a little pressure on it, elevate your leg.
Right.
Don't run around the living room screaming for help.
Don't get on a bus and have to stand up on your way to the doctor. All that stuff.
Right. Yeah. So those are, and then again, like we said, if your symptoms are, truly interfering with your daily activities, then it's time to get evaluated.
Okay. Now you mentioned in taking a break, not a break, but going to that. Let's take a short break. What we're doing is we talked about the immediate short-term treatments. But Doc mentioned a while ago sclerotherapy. I want you to think about that, and so you can say it as well as I can in a bit. But sclerotherapy, we're going to talk about that right after this.
Spring into summer by looking younger. Call Vein Clinics of Hawaii to schedule your free consultation today. Facial and body rejuvenation procedures are designed to help you look and feel your best without breaking your budget. Reduce pigmentation, fine lines, wrinkles, scarring, and stretch marks with minimal invasiveness or side effects. Confused about which procedure is right for you? Call 427-5565 to schedule an appointment or visit veinclinicsofhawaii.com.
Yeah, that's always a good way to get an answer. Okay, now, just before that little happy note, we talked about just a few minutes ago the short-term treatment. What he's talking about, if you have this bleeder, you stand, you elevate it. And you compress it, and you don't stand up on it. But one of the things that you mentioned earlier, and it's one of the big words that I've come to grasp, sclerotherapy. In a nutshell, that is what you do by going inside of a vein and doing what to it?
Sclerotherapy, implies that we're injecting basically a medication into a vein. And by the way, before the break, we talked about those situations where people should definitely be evaluated by their doctor or give us a call. Yeah. But if you're having symptoms that you're not sure about, by all means, just call our office and ask those questions of my staff. They all have all the answers, and that's an easy way for you to help you decide whether you should come in and see us or not. But
Google veinclinicsofhawaii.com and we'll get you there to the right office. And by the way, 4 offices. The Big Island, Maui, Kauai, and here on Oahu. So you're never too far away from a clinic.
Yeah. So, sclerotherapy is one of the, modalities that we use to treat vein disease in general. Sclerotherapy is probably most commonly used to treat smaller veins, like spider veins. So, often we're treating people for cosmetic purposes with sclerotherapy of spider veins, and it works pretty well. But do we sometimes treat the deeper venous system with sclerotherapy also? Yes, we do. We often will use the ultrasound machine to identify larger branches off of the superficial venous system, and we inject a medication. There is actually a relatively new sort of modality. It's a medication called a preparation of a medication that we've used for a long time, but the manufactured name is something called Varithena, and that's a prepackaged manufactured form of a medication called polydocanol, which again is something that we've used for a long time, but it's a foam type version of that medication that works particularly well. We've just started using that here in Hawaii, and I actually it's the first time anybody has treated venous insufficiency.
Okay, now you got me. My curiosity's up. I want it. But on that, and I want you to finish that thought. But I can tell you another thing, gang. I've learned this. I mean, this is really the truth. My mom, bless her, rest her soul, a hardworking lady, had her own retail stores, and she was a model. She was basically on her feet from being a model in college to being in her 80s. And so one of the things that I can tell you are extremely different is just the needle itself. People freak out when they know that they're going to get injections of this or injections of that. When, to your recollection, where do they come up with that really small, fine needle? How in the heck do they make something that such a small hole in it?
Yeah, I don't know.
Yeah, it's amazing. Isn't it?
It is. Yeah, the especially for spider veins, we use I think probably the smallest needle you can get.
Yeah, tiny little thing.
And you can. Yeah, sometimes you have a hard time seeing it, but luckily when I'm doing it, I've got magnifying glasses. I'm to that age where I need that now. It's tiny, and actually, I think most of if there is a little bit of discomfort, it's more due to the medication going into the vein than it has to do with the needle.
I'm really glad you say that, because I remember when I had to have one IV, it was very, very cold for a minute.
Yeah.
And then I had this other thing. Now they're putting the medicine in, and it was very, very hot.
Yeah.
So, I mean, it does. And isn't it the practitioner, the way, the speed at which you put it in, and the angle that all makes a little difference?
That's part of it, sure. Yeah. The thing that you were just describing, I think, had to do with whatever it was they were injecting. Some medications can be a pretty strong irritant to the inside of a vein, and sometimes that in and of itself, creates some discomfort. But so sclerotherapy is it has to do with injecting a medication that we refer to as a sclerosant, because it creates inflammation of the inner lining of the vein, and that inflammation then causes the opposing walls of that vein to stick together, and that's how that medication makes the vein close down.
So you're not going to use it anymore.
Yeah.
When I was a child and I first heard the term vein stripping, we've talked about this a lot, and I know, gang, that many of you heard that as well. I'm not sure that it is something that is I know it's still a valuable word, and that there are some cases where you still do a pretty major process, and you can tell us what does that. But what is vein stripping, and is it really stripping it anymore?
Not anymore, but in the past, when we talk about surgical vein stripping, and there's still plenty of people, many people out there that remember having it done, or they remember their mother or their grandmother or whomever.
That's me.
And it was a fairly brutal kind of procedure. Did we strip the vein out of the leg completely? Yeah, the vein came out of the leg.
Wow. By the way, it's not necessarily freestanding in there either.
No,
I mean, they're all mixed up with a lot of things.
It's connected to things. It's connected to things that bleed a little bit.
Sure.
So in the process or in the procedure of vein stripping, we make a bunch of little incisions up and down the course of one of the more major superficial veins in our leg, and then we would thread a stainless steel wire through that vein, tie it off on one end, and then on the other end pull it right out of the leg. So that was a procedure that, again, it should be done rarely anymore, but it was done in the hospital. It was a general anesthetic. We certainly don't put anybody to sleep anymore to do these kind of procedures. But people were in the hospital several days. It resulted in a lot of bruising, a fair amount of discomfort, and it took a little while to get over that procedure.
I'm glad you said what you said about the getting knocked out. You may not get knocked out, but you get to a point where you're pretty much okay with what's going on.
Yeah.
Isn't that more just be at peace and be confident that the guy or the gal working on you is doing the right thing, and then let them do their work.
Yeah. Well, there are those forms of sedation, what we call twilight. Sometimes we do that in the office, but it used to be a full general anesthetic and down the breathing tube and all that sort of stuff, and there's some amount of risk that comes along with even just having the general anesthetic.
What about the blocker? I've heard that expression before, where you have a blocker somewhere in your pelvis, and it sort of knocks your legs out, but keeps your heart and your mind and your face going. Or whatever it is.
You can have a kind of a regional, nerve block. That's going to, decrease sensation to like one extremity, or a spinal anesthetic. There's that too. That's going to affect the entire lower half of your body. But you're still both of those things are still a little riskier than it is just doing it under a local anesthetic.
And by the way, most of my experience is the latter. In other words, you walk in and you know what you're there for. It's all set up and you're ready to go. You get prepared. The team comes in, they do their thing, and afterwards you have a little, a piece of cracker or a chocolate bar or whatever it is, and you go home. Which is good.
So nowadays what we do, the procedure that we do is referred to as endovenous ablation. That is the procedure that has taken over for surgical vein stripping. And people come into the office. It's a 45-minute procedure. Some people take a little Valium. Some do. Some don't even do that. But it's all through little needle puncture sites, and the patient, we do a little wrap with a stocking, and the patient kind of leaves the office and goes on with their day. One
question that's not on the list that I was supplied, but one that popped up to me is at any given time, how much work can you have done? And I know that it's a wide open question, but I would imagine there's some practitioners and some patients that can either work a little bit quicker or take the discomfort a little bit easier. So they may not need to have as many treatments as others.
It's a little different for everybody. We like to do as much as we can at one time. We split it up a little bit for patient comfort.
Sure.
We don't want them laying there too long. And then also the other consideration is There's, with respect to the local anesthetic medication that we give, there's a maximal amount of medication that we can give any one person at any one time.
Sure, I get it.
So that makes us split things up a little bit too.
Yeah, and by the way, that's all part of the decision-making process. I think what you've said in the past, and gang, Dr. Juleff, by the way, Vein Clinics of Hawaii, 4 islands. Go to veinclinicsofhawaii.com and file questions like this. But I do know that you get more, the more a practitioner is good at what he does, the more you're able to get done in one session.
Oh, yeah.
Just based on just sheer experience.
Right.
You know?
Yeah, absolutely. It's like everything else. The more you do, the more efficient you're going to be, and the less trauma and time for that particular patient, which is important. You know, we like to do it in as pain-free of a style as we possibly can. Yeah,
and that bodes for the right treatment. We'll talk about that another time. There are a few more of these FAQs, or frequently asked questions, that we'd like to get done. You know, I asked earlier, when you get when you're going to draw blood, do you draw it out of a vein or out of an artery? What about the confusion about arteries? And you know, what's the difference? And what are problems with the arteries and problems with the veins the same?
They're very different.
Yeah.
For many people, when they come in and we start talking about veins, they're easily confused. I mean, obviously, if you haven't been educated in that particular thing, but arteries are the blood vessels that carry blood from our heart to our body, and veins are the blood vessels that carry them back up. Veins are deep within the extremities and the body in general, as are arteries, but typically what you see superficially, if you see a blood vessel superficially, that's a vein.
Okay.
And the structure of the artery and vein are quite different. Veins typically are very thin walled. They're much more pliable. They're much more compressible, whereas arteries are thicker. They have a little more of a muscular layer, which allows for variation in the size. Although veins kind of change in their size too, depending on what what the environment's like or what the blood flow volume is like. But veins in general, I think, are a little weaker and less able to withstand changes in pressure and all that sort of thing, and that's why I think that we have this whole process of venous insufficiency in varicose veins, because they're not as easily able to withstand sometimes what they have to go through.
Okay, well, I know two things about arteries and veins. One of them is you don't have valves in arteries, so that's not an area that can get hurt or need treatment. And you have lots of valves in your veins.
Correct.
So that must mean the main two difference between what you're fixing is valves.
Yeah,
or a valve that's not working, going around it somehow.
That's a very good point, Mike.
Like I said, and by the way, my surgical hours are different than Doc's. I have none.
So I mean, blood flows through arteries because of the heart. The heart pumps and it pushes blood through arteries, but not so for veins. And as you pointed out, especially in our legs, movement of blood through the vein is very dependent on intact valves, as well as the musculature of our legs, contracting, which forces blood upward again if the valves are intact.
What I'm amazed at are there now procedures and things that you can do that operate as an external pump. That there are treatments and there are things that you do on a regular basis to people that have big, venous insufficiencies. They say you can get help not just from the inside but from the outside.
Right. Yeah. There are devices like that. That create external compression or external pressure that's going to allow the veins to work a little better. The one that came to mind was, and I read a story about this. A procedure that had been developed in venous surgery that got taken to football fields to immobilize a broken leg or broken ankle or broken arm. Yeah. That you just put pressure around it with this balloon and pain goes away and you can transport that person to treatment. Right. Yeah. What we use in treating vein disease is very similar to that. It's just that it's called an intermittent pneumatic compression device. So the device goes up and down. It fills with air and pressure, and it starts at the bottom and works its way up. So it's kind of pushing the fluid and blood upward. But yeah, we use that kind of stuff all the time.
Interesting. Okay, so you mentioned earlier, an ulcer, and I know that's a showstopper in a lot of cases where people don't really know. What do you mean an ulcer? Is that like a peptic ulcer from something I ate? An ulcer basically is a hole, right? Yeah. And venous ulcers are pretty common.
They are. Yeah. And that's another one of those things that people don't necessarily relate to, vein disease. So they're not exactly sure where to go to be treated or to get help with that. But
one would almost think many cases, and we've talked about this in gang, there are a tremendous inner working now between practitioners, particularly specialists, where maybe something looked like it would be a dermatologist problem, and for months you're getting treated for something that it looks like a skin problem and it's not.
Right.
And vice versa. Every now and again you might have what you think is a vein issue, and what you really need is a dermatologist.
Yeah. And that we see all the time.
Sure,
people are being sent to dermatologists because of the skin changes that occur in venous insufficiency. And that's when ulcers, start to happen, is when the skin becomes very damaged. And it's thickened, it's irregular, it's pigmented, and the ulcer basically, it's just and often the ulcer starts from some other minor traumatic kind of event. Somebody hits their leg against the coffee table and the skin breaks. It doesn't heal, and then it starts to break down even more, and then ultimately you're left with a pretty good-sized area of, raw sort of tissue.
Isn't it sort of amazing? You talked about that before. Some people will go on over and over and over putting some, ointment on it or something in a Band-Aid, and 6 months later it hasn't healed.
Yeah. Yeah, and if it, with respect to that, if an ulcer or a sore on your lower leg is not in the process of healing, or at least moving in the right direction over the period of several weeks, then there probably is something amiss. And one of those things that might be amiss is venous insufficiency, and certainly you should have that looked at, especially if that leg has chronic swelling, skin discoloration, abnormal looking skin, or as you alluded to before, a rashy kind of appearance to the skin. That's a leg that is fairly late in the course of venous insufficiency and should definitely be looked at.
Okay, we are just scratching the tip of the iceberg here. We hope that you've learned some neat things, and we hope to add on to these frequently asked question shows as often as need be. So if there's something that you'd like to get covered, or if you learned something today, let us know. Go on to the Vein Clinics of Hawaii website, Vein Clinics of Hawaii, and get in contact with us and let us know how you're doing on that, because it's looking around this way that's kind of neat. And one thing real quickly, Doc, if you could spend some time, I do know that a lot of what you do at the office and staff is helping to determine which of the procedures and what is and maybe more importantly, what is not covered by insurance companies. Yeah,
by and large, and this is another question that people have because they assume that much of what we do is not covered by insurance, but it's actually just the opposite. 95% of what we do is considered medically necessary. It's covered by Medicare and insurance. The only thing that is not are those things that are strictly cosmetic. Yeah. And basically it's just spider veins.
Yeah. And by the way, though, I don't care, because I like the way your leg looks after, so I'm going to still have mine. But most of this stuff is, and I think it's a smart insurance company situation in this day and age, because they know by, extending quality of life and other things, you stay healthier. If your legs are in good health, you're a healthy person.
Absolutely.
Okay, so we hope, like I said, you've learned something. And what we want you to do is come back again next week. We'll do another show. But in the meantime, you go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And so, like I said, we'll see you next time. Thanks for listening. Appreciate it.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.